A&E patients could be treated at home to avert another winter Armageddon. I'm going to read into this exclusive from the iPaper, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an exclusive from the iPaper with the headline that A&E patients could be treated at home to avert another winter Armageddon. So ministers and officials are working on an urgent emergency care plan. Guys, while you're here, make sure you hit that like button and share it across social media so others are notified of this video. So there's a couple of things that came to my mind before we read into this, guys, when you think about that. So first and foremost, they're talking about treating people at home instead of treating them in the wards where they have everything that they need there. That's the first thing. The second thing is that who is going to be doing this? Because if you're going to be treating people at home instead of treating them, if these accident emergency patients, and not treating them in the hospitals and the wards themselves, who's going to be doing that? Like, are we going to have a separate department of people who go out to deal with A&Es on the go, sort of thing, like a special ambulance service that goes and treats them in the place where they have it instead of actually treating them there? So here's the thing, like, you need. I'm not sure how this is going to work. And then thirdly, I'm assuming this is going to tie into social care. Of some sorts, because obviously some people will require care, a lot of care on the as well. So there's a lot of questions to be asked about this, like this term of trying to avert. Like, of course they want to try and avoid another winter, a winter of chaos, that is for sure. But we've had a triple whammy of not just the cold and the flu, but also we're still dealing with COVID aftermath. People forget. Yeah, COVID still exists, even though it's not as fatal as it used to be anymore to some people. There are still people out there who are still fearful of it. But I'm just trying to understand, how can accident and emergency patients be treated at home? Like, when someone breaks their leg, what are you going to do? Do an operation in their bedroom or something? How is this going to be? Like, is it going to be a case of they're going to, when someone has a terrible, nasty injury or whatever it is, they bring all the things that they need to them? And what if you end up going to that person's home or wherever that may be, you have all the supplies you need, but you forget something or you miss something? Like, that could be the difference. That could be the difference between someone's life and death. Whereas in the hospital, everything is there, everything that you need. The bodies are there. So I'm not quite sure how this is going to work. But maybe some of you might have a better idea in the comments to leave down. But let's have a read of this nonetheless. So plans to treat more people at home or in their local area instead of in hospital are expected to form part of a major overhaul of A&E care to be published this spring. So ministers or officials are working on an urgent emergency care plan, likely to be unveiled in February or March, to prevent the NHS in England suffering a repeat of what doctors describe as Armageddon scenes in hospital this winter, where patients have been waiting for hours in corridors before they are treated. And by the way, let's be very, very clear here. Like, if they made the flu jab or the COVID jabs, like those kind of things, if they made them free for like 40s and above, like, or, you know, if they did them like, if they offered those for free, some of these jabs, like, that would significantly reduce people having it as well. Just saying. While the details have not been finalised, experts and insiders expect a key part of the plan to fulfil one of Health Secretary Wes Streeting's 3 strategic shifts, where the burden of care is shifting from hospital to the community. So rather than the hospital doing its job of looking after people, let the people in the community take care of them. While A&E departments will still handle life-threatening emergency cases. Okay, well, that's a good start. One way to reduce the burden on hospitals would be to increase the number of patients seen in the community. This could be at dedicated local respiratory hubs, where medics can prescribe medication for chest infections or asthma, or at home by urgent community response teams where doctors and community nurses can visit older people who need medical attention that does not require hospital admission. Those kind of things, again, like, I have no issue with that. But again, where are you going to get the doctors and the nurses for them? Like, that's the question. We have a problem. We have a recruitment crisis at the moment as well. Respiratory hubs and urgent community response teams, the UCRT, are already in operation in the NHS, but it is likely that a new A&E recovery plan would propose an expansion of their use. The UCRTs are currently made up of healthcare professionals such as nurses, psychotherapists, occupational therapists and social workers. At the moment, they deal primarily with older people and adults with complex needs who need urgent care, which is made available within 2 hours. This can include prescribing medicine and access to occupational therapy. Plans to shift more care from A&E to the community could see significant expansion to the response teams. NHS leaders and health officials believe that keeping elderly people out of hospital, unless they need to be there to allow them to live at home more independently and prevent things such as muscle wastage from spending too long at a time in a hospital bed. But unions and experts say that any recovery plan for A&E would be credible unless it includes urgent measures to tackle capacity and staffing shortages in social care. While Lucy Casey's long-term commission into the sector is ongoing. Social care shortages are leading to thousands of older people remaining in wards because they cannot be discharged safely into the community, which has been a knock-on effect on A&E departments because demand is routinely outstripped bed capacity in many hospitals. Yeah, this is the only problem is that we just don't have enough beds to deal with everyone as well. That's another issue that needs to be addressed. Unions also want ministers to urgently address the problems of staff recruitment and retention in all parts of the NHS and social care, including GP surgeries, hospitals and care homes. So the Department for Health and Social Care spokesperson said A&E services have been under immense pressure again this winter as they deal with a broken system. We secured an extra £26 billion for the NHS at the budget, introduced the RSV vaccine and ended with restricted doctor strike to ensure staff are on the front lines and not on the picket lines this winter. This is just a start and we will publish our plan to reform urgent and emergency care later this year. So this is the scale of the problem as well. To add to, so treatment backlogs, social care shortages and a quademic of high flu cases, norovirus, COVID and RSV have left NHS hospitals facing one of the worst winter crises in years. It is believed that 14,000 patients currently in wards are well enough to be discharged, but cannot be sent home because there is no space either in a care home or support at their home via a locally funded care package. 1 in 7 beds is occupied by a patient who doesn't need to be in the hospital. This is a major problem. If you can, you must fix social care. Social care needs to be fixed. We need a huge amount. We need a massive recruitment drive in terms of social care as well to help deal with that. A report by the Royal College of Nursing last week found that 9 in 10 nurses believe patient safety is being put at risk due to overcrowding in hospitals, and 7 in 10 said they were forced to care in corridors, converted cupboards and car parks on a daily basis. Since the new year, several hospitals in the UK have declared a critical incident, meeting demand is outstripping capacity. The Health Secretary himself admitted earlier this month he felt distressed and ashamed of the state in the A&E after witnessing patients crying out in pain and being treated in corridors. Dr. Len Lafayette, emergency medicine lead for the British Medical Association, told the iPaper, right now the situation in accident emergency departments across the entire UK is absolutely unsustainable. It is beyond all doubt the absolute worst I have ever seen. In some hospitals where were patients in corridors at all times over the past 12 months, with some having more than 50 patients waiting in these places, she added. And it has absolutely got worse over the winter period, and we are now in a position where it just feels like Armageddon. So what is happening now to deal with the crisis? So despite the urgency of the crisis, Streeting has insisted that rushing through a plan to tackle any problems now will have little immediate impact on the hospitals, and that the focus should be on proper packages of measures to be published this spring to head off another winter crisis next winter. In January 2023, during a similarly tough winter, Rishi Sunak's Conservative government and NHS England published a delivery plan for recovery, urgent and emergency care. This included £1 billion of money, plus 200 for ambulance service to increase capacity, grow the NHS workforce, improve discharge, expand healthcare and care outside hospitals, making it easy to access the right care. A progress report published by NHSE last year said the organisation had delivered and are on track to deliver on all the key actions in the plan. But despite the measures, demand has continued to soar, and Labour's ministers and officials believe a new plan needs to do more to tackle the problem. An NHS spokesperson has said that the NHS delivered on its 2023 urgent and emergency care plan, including extra beds, more staff and more care in the community through proven measures like virtual wards. While there has been some improvements in performance, there is much more to do to bring down long waits for patients. This has been one of the most challenging winters with record demand, high bed occupation and pressure from winter viruses. And in the coming months, the NHS will publish a new plan to cut A&E waits and deliver on the government's mission to shift more care from hospital to the community. So what is community care? So this shift from hospital to the community, one of 3 shifts identified by Streeting that's essential to improving the NHS, is expected to be the core focus of the forthcoming Labour government and NHS England's plan. This is likely to include more respiratory hubs where people with non-emergency conditions can receive treatment from medics. They are either based at GP surgery premises or at separate locations. I will say that obviously people who don't have emergency situations, if we can treat them outside, if it's not as severe, I mean, it's a case-by-case basis, I have to stress again. But like it says there, obviously, it depends on what the case is and how severe it is, whether they need to go to hospital or not. It would also be likely to see us more use of at-home urgent care response teams. Again, we need to get the people. If you want people to do these at-home response teams, you need to hire the people and the vehicles for them as well. Where people, particularly the elderly, can receive treatment or medication without needing to go and wait hours in A&E. A joint statement last Wednesday from the Royal College of Emergency Medicine, Royal College of GPs Association Ambulance Chief Executive, the Patient Association said others said any shift from hospital to community would need more funding from primary care and a cutting of red tape to free up more time for GPs. They also call for more frequent users of urgent and emergency, such as older people and high-risk groups. We have full health MOTs every year to head off problems that might eventually send them into A&E. Health MOTs are currently only available to people aged 40 to 74 every 5 years. This should be something more looked into then. These frequent users could be offered wearable devices to monitor cardiac and respiratory activities for early intervention by a GP or a community nurse. Rory Delegan, acute director at NHS Confederation, said, "The more you can take out of the emergency care system is the better, whilst ensuring that those that do need emergency care can access it quickly and safely as possible. A lot of these schemes can do to fit in with the government's wider narrative of moving out of hospital into the community. We will support a model of the care that supports people in the community and having more investment in long-term solutions that allow people to live and be treated at their own home." The problem is obviously it does depend on every single condition. And the thing is, they use the term community, like it's hard for some people to, like, some people just are not part of a community and they're just kind of living on their own in their home. So not everybody has that community homey feel. If some people are just isolated, like some people just don't have those family and friends. Like this, I see this premise that they're trying to create of, people can look out for them, neighbours can look out for them, rather than social care looking out for them. I'm a bit worried that they're going to try and make that premise on people, but not everyone's going to buy into that as well. Because some people just want to be left alone as well. This is about the left shift, taking people out of the hospital into the community, trying to help support people in their own homes for as long as possible. Putting older people in hospital beds is not necessarily the optimal solution for someone 75 and over. For example, every day they are in the hospital, they lose 5% of their muscle capacity and are less able to live independently. That's not good. Yeah, you always want to make people to live give them as much possible. Tim Gardner, Assistant Director of Policy at the Health Foundation, said the new A&E plan would need to tackle fundamental problems of bottlenecks in the flow of patients into, through and out of hospitals. We need to get better at enabling patients to flow into and out of hospitals where they need to. A big part of that is going to be tackling delaying discharges and improving community-based NHS service. The previous government's urgent and emergency care plan was doing the right things, but a bit underpowered, he added. I don't think there is a wholesale revisit that the new government needs to be doing in terms of updating the urgent and emergency care plan. But it really needs to think more ambitiously and think about how it can transform service that it was done under the last Labour government in the early 2000s. And think about the whole system plan. It can set an ambitious target for when it wants to be by the end of Parliament. And social care, one of the key components as well, guys. It is not known whether the new A&E plan this spring will include a short-term measure for social care, which would be separate for Louise Casey's review into the sector. So she is not due to publish her first findings until next year and a full report until 2028. But Gardner said, "I don't think a new plan is credible without some form of intervention to improve access to social care support in the short term." Now, it is entirely possible that the government could put more resources into the social care system now, as well as thinking about the long-term reform of the system. The Royal College and Ambulance Service statements call for more urgent measures to help tackle the lack of funding and capacity in social care system. They said the solution for social care cannot wait until 2028. We must begin to increase social care capacity before next winter. The Littleton said the most pressing issue for the NHS is the issue of social care provision. We know that social care sector continues to operate under immense pressure. 20% of NHS bed capacity has been taken up by patients who shouldn't be there. They are medically fit enough to be at home but cannot get a suitable care package. That is the thing that is absolutely overwhelming the NHS this winter. There is no point having an emergency care recovery plan if you don't solve the social care issue more broadly. Lanier said, at any time in any hospital in the UK, there are dozens, if not sometimes hundreds of beds that are occupied with patients that can no longer need hospital care, but cannot be safely discharged because they need care in the community. Those carers mean that nursing homes placements are in very short supply, and they just don't exist. Just means patients are trapped in hospitals, so means that new patients arriving are really struggling to access those beds. So the social care sector absolutely needs looking at. And finally is there's a couple more still here, guys. Staff shortages. Experts and union leaders said the new plans to alleviate pressures on the A&E would need to address chronic staff shortages in the NHS and care sector. Daniel said, we know that a lot of staff are leaving. We know they are seeking better terms and conditions in other countries, and that's the problem. It's better for them to work in another country than here. The government really needs to address the historical pay erosion that it has subjected NHS workers to, and look at how to incentivise staff to stay in the NHS. Because with the amount of rota gaps that we have up and down the UK, we cannot possibly deal with the equality of patients we're trying to look after if we don't have the staff to do it. I've written more references for junior doctors moving to Australia and New Zealand over the past 2 years than I've written for the rest of my entire career, and I've been qualified for more than 20 years. It's better for them. It's cheaper for them. How can you beat that for them? They are leaving in droves because conditions are so difficult, so challenging. Doctors and other healthcare workers have seen their pay eroded so significantly. Patricia Margrias, RAN Executive Director for England, said, there is no turning around NHS service and ending corridor care without addressing the crisis in nursing. As the largest workforce group delivering the vast majority of care in every service, we are best placed to help develop and implement new ways of working. But this will require political imperious and new investment to increase capacity and recruit and retain staff we need, including in community and social care services, which are so essential to delivering care closer to home and easing pressure on the NHS. The government and NHS leaders must learn the lessons of this winter and implement proper reporting for all instances of corridor care. One of the biggest drivers of vaccinations as well, guys, which is what I mentioned earlier as well. So one of the biggest drivers of demand on A&E this winter has been higher than normal rates of flu. Although the NHS has been dealt with similarly bad flu seasons in previous years, this year has been a compounding factor with all other problems hospitals have been dealing with. It's not known whether the new A&E plan will include vaccinations take-up, but experts agree that increased public health awareness of the flu jab will alleviate pressures on the hospital next winter. Yeah, here's the thing, I'm all for more alleviating and more awareness of vaccinations and whatnot. But some people are just not willing to pay for it. Some people are not willing to pay for it. You need to incentivize more people to take up jabs. The Royal College and Ambulance Service called for flu jabs to be made more widely available next autumn beyond the existing cohorts for over 65s and those with chronic health conditions. Uptake on the flu vaccine has been lower than in previous year and started later. Daniel said the government perhaps has some work to do there about publicising the importance of vaccines and a bit more of a public health campaign to encouraging the people who do qualify for vaccines to go ahead and get them to try and prevent them becoming ill in the first place. Denton said, there could be more prominent vaccination campaigns next year. We know the communities that are most unvaccinated. There could also be really visible public campaigns advising people to go to the right service at the right time. For example, GP 111999. Yeah, that's a lot of. I think a lot of problems. Scale of the problem, what they're doing now, community care, social care, staff shortages, vaccinations. It's a huge, it's a mammoth challenge, guys. It's a mammoth challenge. Many different parts of the National Healthcare Service in England is in deep crisis. But we know that it has been a direct impact on the Conservatives. have been by the Conservatives and what they have done to the NHS. Do I trust Wes Streeting to do what's right for the National Healthcare Service? Absolutely not. No, I don't trust him. But do I think he will do a better job than the last Conservative health secretaries that we've had for a long time? Yes, I do. I would like to think that next winter will be a lot more under control. But while they're making these massive, significant changes, we're still having people struggling. A lot of money has been given to him to fix the NHS, and it's going. And the reality is, and I've said this, is going to take time. Now, like I said at the end of this year, what I want to see is I want to see improvement. I want to see signs of improvement. Now, I'm not expecting the NHS to be perfect. I'm not expecting. I'm expecting another crisis at winter, next winter as well. But the reality is, it's going to take time. But what I want to see is I want to see people. I want to see the changes, and I want people to say that they've been getting better care. The more particularly, there's the key word is social care. The social care is one of the things that is definitely in need of work more than any, I think, out of all of them, because that's what's taking up a lot of space on the beds. And like they said in the report there, you can tell that a lot of people who did not need to be there have to be there, and looking at ways to try and get them, not have them in there in the first place. We know a lot of elderly people tend to go to hospitals when they don't actually need to go to the hospitals. It's a very valuable piece of information, a very good exclusive piece by the iPaper there, guys. What do you guys make of it? What do you guys make of A&E patients could be treated at home? What do you make about the crisis in our National Healthcare Service, particularly in England, guys? Let me know your thoughts and more on this down in the comments section below. If you found this video informative and helpful to you, please hit that like button, would be greatly appreciated, and share this across social media so others are notified of this video. If you haven't subscribed already, please consider subscribing, because it really does help support the channel. And if you want to go one step further and financially support me and the work that I do here, you can do so by becoming a YouTube member for as little as 99p, or join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching, and I hope to catch you all very, very soon.